My name is Professor John Boyages. I'm a breast cancer specialist and radiation oncologist. I'm an author of Breast Cancer Taking Control. I am the founding director of the Alert Lymphoedema program at Macquarie University Hospital, and I'm a practicing radiation oncologist at the Icon Cancer Centre at the Sydney Adventist Hospital at Wahroonga in Sydney. So what is lymphedema? When we treat breast cancer, we often have to treat the lymph glands under the armpit. This could involve simple surgery, such as a sentinel node biopsy, or more complex surgery, such as an axillary clearance. Once we remove those lymph glands from under the armpit, the fluid which naturally circulates around our body and under our skin to keep our tissues healthy and to help us fight infection can slow down and become blocked at the armpit. What can then happen is the fluid in your arm can slow down. It's a bit like cars going down a highway and getting to a toll gate, so they can't get all through at the same time. And that's what lymphedema is. It's like the fluid getting into the tissues and not being able to escape. So how does lymphedema present? I know the first thing I do when I examine patients is look at their hands and look at their fingers, see whether the rings on their fingers are getting tight, see if the grooves between the tendons on the back of the hand are filling up. I might even press on the back of the hand or up towards the elbow with my thumb to see whether I can cause an indentation. When I talk to a patient, I might ask them, are you having difficulty putting on a sleeve or putting on your rings? These could be signs that maybe there is a little bit of swelling, but we often don't know, is that because the patient's putting on a little bit of weight? And many patients do gain weight after chemotherapy and hormone treatment. Just going through breast cancer means that people are less active, or they may change their diets and so on, or be on steroids. Is there some transient swelling? You realise that at the end of a long day there's some swelling, but in the morning it disappears. That could be a sign as well. Numbness, some skin changes. And it may be that when you have more activity, it might be in exercise on a really hot day, and for very few patients, perhaps even flying, with changes in pressure, you might find that your arm doesn't feel quite right. Really important to get it checked out. One of the difficult areas is around flying, and I've seen some patients who've never flown after breast cancer because they're so scared that they may get lymphedema. Get to know your own body, work out when your arm changes or doesn't change. If you're flying a long distance, if you're at higher risk, perhaps being overweight or had infections after your surgery, or are known to have lymphedema, or you've had a complete axillary clearance, by all means see a therapist and get a garment. Or if you're risk averse and say, look, you don't want any risk, just go get a garment, move around on the plane, drink lots of fluids. Although we encourage patients to have an injection and blood pressure and so on, or tests in the other arm, if you don't have veins left because you've had chemotherapy and so on, then it is okay to go for the treated arm. There is absolutely no risk as long as they do it in a clean way, with aseptic technique, and you watch it afterwards. If there's any redness, jump on it with some antibiotics or some alcohol or some betadine, iodine wipe. But you know, the British guidelines say if you've had 2 injections or attempts at taking blood tests from your affected arm and it's failed and you're getting stressed and you're getting sweaty, just say to the doctor, I'm happy to have it in that arm. There's been 2 studies now where they compared the lymphedema rates in weightlifters, in a group that got weightlifting, in a group that didn't have weightlifting, and in fact the weightlifters had less lymphedema. So exercise is good for you. It helps the muscles push the fluid around, but get to know your own body. If you feel it's hot or you're doing a lot of exercise, perhaps wear your compression garment as another prophylaxis to help the fluid move along. If you're still worried, there are a lot of resources out there to help you. Keep looking at the My Journey online tool. go to the lymphoedema.org.au website, which is the Lymphoedema Australian Lymphology Association website. Speak to your doctor, speak to your therapist, or come and see us at the Alert Lymphoedema program.